Hello guys, my name is Arief. I'm one of the directors at Elite Activities, and currently I'm working as a clinical pharmacist at Northern Health Hospital in Melbourne. And in today's video, I'm going to share a few things regarding the PEBC examination. So we all know that it's a well-known fact that PEBC is one of the world's toughest examination, and many candidates they keep on failing this examination in the first attempt, second attempt, and so on. So in this video, I'm going to share a few important basic things like why the candidates they often they fail and what are the few tips and tricks how they can improve in clearing this PEBC examination in their attempts.
Well, when it comes to the question that why do candidates fail in the PEBC examination? Okay. So at first, before knowing about why the candidates they fail in the PEBC examination, let's have a look through the PEBC syllabus. Okay. So here is the complete syllabus for the PEBC, the subjects and the percentage or the weightage for each subject. So the first one is the biomedical sciences, which carries around 15% weightage. The second one is the pharmaceutical sciences, which carries around 25% weightage. Then pharmacy practice, which carries around 50% weightage. It has got two components in it. One is the clinical sciences and the other one is the professional practice sciences. And the last one is the behavioral, social, and administrative pharmacy sciences, which carries around 10% of weightage. So now let's have a look in detail about each subject or the each component, and we'll see that where the candidates they will fail and why the candidates they won't emphasize on those components and so on. Okay, so here is the overall percentage distribution of the subject. So the first one is the pharmacy practice, which carries around 50%. The second one is the pharmaceutical sciences, around 25% of the weightage. The third one is the biomedical sciences, 15%, and the last one is behavioral, social, and administrative pharmacy, which carries around 10% of weightage. So from this graph, it's clear that around 50% of weightage is for pharmacy practice. Okay. So when candidates they look at this graph, like when the candidates they look at the syllabus or the blueprint of the PEBC, so everyone they will think that okay, if we focus on the pharmacy practice, if we focus mainly on the pharmacy practice, then it becomes much easier for us. If we focus on pharmacy practice, out of 50%, if we can score around 40% from pharmacy practice or 45% from pharmacy practice, then only we need to score around 15 or 20% from the other component. Okay? Then they will start focusing mainly on the pharmacy practice. Okay, so that's the major mistake that the candidates they do here. Okay, so now let's have a look through individual components, and I will explain you in detail. So, like where we need to focus and which components are more important for the examination. Okay? So the first one is about the 10% weightage. This 10% weightage is for the behavioral, social, and administrative pharmacy. So where we will be having the subjects like the biostatistics, pharmacoeconomics, Canadian healthcare system, and pharmacy management. Okay. So these are all the subjects like for especially for overseas pharmacists, those who have studied in India or Pakistan or any other countries all over the world other than Canada. Okay. So for them, these subjects become a big challenge because they don't know about the Canadian healthcare system. Okay, so even in the pharmacy levels, in the bachelor level in India and in other countries, so they don't study about the biostatistics. They won't study about the pharmacoeconomics, okay, and pharmacy management. So all these are the completely new subjects for them. So that's why most of the candidates they will try to completely avoid this 10% of the subjects. So they think that, okay, it is just 10%. So let's skip this 10%, okay, and focus on the other components. But that's the main mistake here. Okay. So if we study the biostatistics, so you will get at least 5 to 7 questions from the biostatistics in your examination. So, and the basic things that they will ask in the biostatistics, like which test is to be applied here. So which test is applied in this scenario, like either the chi-square or the student t-test or the ANOVA. So which is applicable test in this particular case study. Okay, so it is quite easy. Like if we learn it once, okay, so it is quite easy. And for all these subjects like biostatistics, pharmacoeconomics, Canadian healthcare system, and pharmacy management, so once if we learn, And if we do just once or twice revision, then they are quite easy and simple questions. They won't try to twist much in this part, so easily we can answer them. Okay. So my advice is you should never skip this 10% of the component. So we must focus on the statistics, economics, Canadian healthcare system, and pharmacy management, and try to get as much score as possible in this part. Then the second part is about the 15% weightage for the biomedical sciences, where we'll be having the biochemistry, molecular biology, physiology, immunology, and microbiology. Among the 5 subjects here, physiology plays a major role. Okay? So let's say, for example, if there are total around 15 questions from biomedical sciences, out of 15 questions, at least 5 questions will be from physiology. And the remaining questions, 8 to 10 questions will be from all the other 4 subjects. Okay? So the highest weightage will be for physiology. And if we are perfect in the physiology, then our pathophysiology part and therapeutics part will also become much easier. So which will be covered under pharmacy practice. So we need to emphasize on the physiology part. Okay? And it means that we should not skip the other components like the biochemistry, microbiology, immunology, and uh, molecular biology. So all the other components also, like they will ask only the basic things. They won't ask much in detail. Okay, so they will ask all the basic things. So once if we study, once if we practice, then easily we can score them. Okay, so it's easy to score all these subjects. So it means that the 25%, the 10% of the behavioral, social, and administrative pharmacy, and the 15% of the biomedical sciences. Okay, so both together it makes around 25%. So from this 25%, actually we must target to get at least 15 to 20%. Okay, so we should never skip these subjects. So these are the basic subjects, but we should target maximum from this subject because it is quite easy to target from this subject. Once if we study, then it's quite simple and easy to target from this subject. Okay. Then the next one is around 25% weightage for the pharmaceutical sciences. So in pharmaceutical sciences, we have pharmaceutics and the drug delivery system, pharmacokinetics, and biopharmaceutics. Okay. We also have the medicinal chemistry, pharmacology, toxicology, and biotechnology. So among all these subjects, the most important one is the pharmacology and toxicology. Okay. The highest weightage, the highest question that you can expect is from pharmacology and toxicology. Okay. And if you are perfect from pharmacology and toxicology component, it becomes much easy for you in therapeutics, that is in pharmacy practice. So if you are perfect in the pharmacology, then it also becomes much easy for you in therapeutic part. Okay. So focusing on pharmacology and toxicology is the most important one, and also on biopharmaceutics. So biopharmaceutics and pharmacokinetics. So here they will ask you few calculations related to pharmacokinetics. Okay. So you won't get much calculations here at this stage in pharmacokinetics. So only few calculations you can expect from pharmacokinetic part. Okay. Then when it comes to the pharmaceutics and drug delivery system, you will get the questions on the tablets, capsules, emulsions, syrups, okay, suspensions, and so on. So where they will be asking about the different type of the excipients that are added, what are the common lubricants that are added, and also the other questions on the different types of emulsions, what are the suspending agents. So all these are the common things that they will ask in pharmaceutics and drug delivery system. Then the next part is the medicinal chemistry. So in PEBC, actually they don't ask much questions from the medicinal chemistry. Okay. So when compared to the Australian CAPS examination, in Australian CAPS examination, there will be 50% weightage for the chemistry, but in PEBC, just it is a minor component. So hardly you will get around 3 or 4 questions from the medicinal chemistry part. Okay. So it means that we need not to emphasize much on the medicinal chemistry, but you need to learn about the stereochemistry. Stereochemistry is the major one. So let's say, for instance, if there are 3 questions, out of 3 questions, definitely there will be 2 from stereochemistry. So I always advise the candidates to practice and to learn, become familiarized with the stereochemistry component. Then biotechnology, minor part. So you will get a few questions from the biotechnology as well. Then the main target topics. So as we have seen that the remaining topic is the 50% is for pharmacy practice. Okay, so pharmacy practice, it carries the remaining 50% of weightage. Okay, but from pharmacy practice, even though how hard you try, it is highly difficult to score from this component. Okay, so difficult in the sense like we can target up to 25% from the pharmacy practice out of 50. So we can target 25% from pharmacy practice. Okay, or hardly up to 30%, but not beyond that. Okay, so instead of spending more time on the pharmacy practice component, if we can divide our time, if we can spend our time on other components, like on biochemistry, on pharmaceutical sciences, on behavioral and social pharmacy, so we can easily make up to 60% and we can clear the PEBC exam. Okay, so here is the target topic and the percentage that we need to target in our examination. So from pharmacy practice, we can target only up to 25% or hardly up to 30%, not beyond that. Okay, so 25 to 30% if we can achieve in the pharmacy practice, so that is more than enough. Then from other components, from all the other components, that is from biomedical sciences, pharmaceutical sciences, behavioral, social, and administrative pharmacy, from all the other components, so if we can score 35%, okay, and this 25% to 30%, so it will easily make our final score to above 60% and we can clear this examination. Okay, so these are few important things that the candidates they need to know while they are preparing for the PEBC examination. So don't focus mainly on one major component, that is the pharmacy practice. So also focus on other components like biomedical science, pharmaceutical, and behavioral, social, and administrative pharmacy. So to make sure that we need to cross that 60% overall score. Okay, so the advantage in PEBC is, okay, so in PEBC they are not assessing in individual components. So there is no such target that you need to score out of in pharmacy practice, out of 50% of the questions, you must score like 60% from pharmacy practice. So there is no such type of component-based target. Okay. Whereas in case of CAPS examination, Australian CAPS examination, so in each component you must get 50% of score. But in PEBC overall, in all the subjects together, in the final score you must get 60%. Okay. So such type of the individual component scoring is not required for PEBC. So that's the advantage. So that's why if we can plan on more on all the subjects, so rather than focusing on one of the components, so if we can focus on all the other components, then it becomes much easy to clear this examination.
Well, thanks for watching this video. And at Elite Expertise, we are going to launch our first batch of PEBC from 20th of July, from coming 20th of July 2024. So, and our program is designed in such a way that we are going to cover each and every aspects of the examination. So we are focusing on each and every component so that the candidates can score easily 60% in their final examination. So you guys enjoyed the orientation session, which is going to be held on 20th of July. And thanks for watching this video. And also, please don't forget to subscribe our YouTube channel. Thank you so much.